when we talk about policy, politics, and public engagement, I think what we really talk about is a world that is changing, and probably changing in ways that we don't even understand or have the full grasp of yet. The faces of the uninsured are changing, as we heard, and I think we'll hear some more from our panelists. Obviously, the cost of healthcare is rising. All of these issues, I know many of you in the audience and know that you can give the statistics about as well as I can, or the panelists. But the issues here and the challenges are incredibly compelling. So we have two panels for you this afternoon to talk about, first, policy solutions, and secondly, about the policy-making process for being able to implement those solutions. Jan and our previous panelists helped us understand an awful lot about GAMC. Let's step back a little bit now and broaden our view to discuss the larger issues of healthcare access and the uninsured. A few facts. I'm sure many of you are very familiar with these facts, and we'll hear some more this afternoon. But according to the most recent Minnesota Health Access Survey conducted by the Minnesota Department of Health and the university, in 2007, about 7.2% of Minnesotans were uninsured, which is a low rate nationally. But again, if we look at people, individuals, that's about 374,000 Minnesotans who were without health care coverage. And of course, that was in 2007. And hopefully we can get some more updated statistics, but obviously what's been going on in our economy since then, and with the programs and services that we're talking about, that number has certainly gone up. Uninsurance rates vary considerably, not just throughout the country, but even in the state of Minnesota, depending on how old you are, where you live, what your race is, what your ethnicity is. Although Minnesota ranks as one of the healthiest states, we've slipped a little bit, we've seen in some of the latest reports that have come out. But despite that overall healthy ranking, we do not do very well when we look at communities of color. We are in the bottom third quartile of all states in terms of the equity of our health services, and I think that is something that we have, I know many in the group have talked about, worked on, but it is an issue that we all, I think, continue to be concerned about. If just looking at healthcare coverage, not necessarily even healthcare status or outcomes, Hispanic and Latino Minnesotans are 3 times as likely as whites to lack health care coverage, that with the rate of 6.4%. And we know it stands to reason, and certainly there have been study after study after study that has shown that although health coverage cannot make you healthy, folks who don't have health coverage, that affects their health in a number of ways, whether their ability to seek out care, whether they delay care. You saw so eloquently from the individuals who are in line to lose their GAMC coverage, lack of prescription medications, a lot of consequences to that. Given all those factors, I think that it's really important that we all come together and have that discussion on how we can have a community that is better off and that has healthcare coverage much more widely available. So what are we going to talk about in these panels? Given that background, the next panel is going to discuss barriers that interfere with the policy-making process, and the panel that is currently up here will talk about some of the solutions. So how are we going to structure this? First of all, we're going to talk about policy and what are the policy options for program services and funding. I have Lynn Blewett and Michael Scandrett up here to talk about the policy issues. I'll introduce them in a minute. Next, the next panel, first of all, we will talk about public engagement. Larry Jacobs is with us to help us understand how does the public look at this. I think we've already heard references in the previous panel to public perception at times being at great variance with the reality of some of these issues, and so how does that public perception affect the issues we're talking about? And then politics. We've got some great experts here to talk about the political atmosphere that all of this takes place in. You can have facts, you can have public engagement, but you have to put that all into the context of what is often these days a very difficult political environment. How do we get away from such strong partisan and polarizing discussions and work together for this common good? And I will really personally be very much looking forward to that panel. Roger Moe and Mitch Pearlstein will be giving us their insights on how to cope with the politics and create a positive environment for effective policymaking.